Welcome, everyone. Today's a great day for us here at Albany County. We're coming together to really get people to come out and donate, because if one person donates, it saves 8 lives. Think about that. And, when you go through, if it's natural causes, someone passes away, it's a little bit easier for the doctors to approach somebody and say, hey, can they make an organ donation? If it's a tragedy, it's a little bit harder, And I remember doing that with my brother when he passed away in a car accident. And the doctors come in and they ask that question. And you're like, really? But it's crucial because every second counts. And that tragedy in your life can make a difference in someone else's life. And that's what we're about here in Albany County, is to really get that message out there to let people know, you know what, you can make a difference. Again, like I said, if one person can effectively affect 8 lives, that's what it's about. The national statistics here in New York State is roughly 29% of people donate. Here in Albany County, 33% donate across the county, but we're trying to up that number with the Department of Health, and we're really doing this registration to get out to the public and talk about it. And I think I brought my driver's license with me. Pretty sure I did. And, it's simple. It just puts a little organ thing on it saying that you donate, and a little heart. And with that little heart, it really identifies, and it makes it easier on your family, too. Because like I said, if it's, God forbid if for some reason why you end up passing away, or if it's just natural, it's one less step that the doctors have to do with the family, that knowing that what your wish is by just having that little heart on your driver's license, on your medical records. It's just a step that you don't have to deal with the family while you're dealing with your own loss and sorrow. But knowing that your loved one really wants to make a difference in someone else's life, and that's what it's about, is really making a difference. So we're kicking this month off to the end of the year, and we're trying to get 500 more people to register here in Albany County to really get our numbers up there. I'm glad that we're leading in the state of New York, but I want to do better than that. And I want to help our, the whole capital region out. I want to, I've been talking to our Rensselaer County side, our Schenectady County side, and Saratoga about challenging them a little bit to do the same thing. It's fun to be in a little competition and, say, hey, look, let's get the word out there. Let's get people involved, and let's make a difference in someone's lives, because, it's tough. And hopefully you're not ever in that situation, but if you are, it's a tough situation to be in when you're waiting for a transplant. And I have a friend of mine that has to get a new kidney, and he got his mother's kidney and he rejected it, and now he has to get another one. He's on a waiting list, and it's been 6 years, and we just found out a couple weeks ago that he got approval for another one. But after a family member donates, it makes it a little bit difficult to move up on that list. And I have to tell you again, it's about quality of life for the family, and about the mother stop worrying about her son, knowing that now we're going in the right direction. But again, I want to thank everyone for being here. Bruce Haley, our county clerk's here. Bruce, thank you for being here. Also, just want to make sure I hit everything. I did. I do want to talk, I do want to mention a couple things, though, very quickly. I would like to thank the Lewis and Hortense Rubin Community Health Fund, Community Foundation for the Greater Capital Region, the Center for Donation and Transplant for being a key partner and supporter of the Albany County Health Department. But I would like to bring up Asia to talk a little bit more before I take over the whole conference. Asia, please.
Thanks so much. Well, good morning, everybody. Happy Donate Life Month. So it's a rare occasion that I get to come up and talk about some positive news in this subject matter, but we do have some good news to share. So New York, in 7 years, we have doubled the number of registrations in the New York State Donate Life Registry. We now have, folks, over 5 million people registered as organ and tissue donors in New York, and that is more than 27 states have as their entire population. So, we're making progress. That's right. We've also passed some really important legislation in the last couple of years. One is to include what we call the donor designation question. That is, would you like to enroll as an organ and tissue donor? Yes, or skip this question. That's the question that you always see at the DMV when you got your driver's license done. We've included that question in the health insurance exchange applications. And that has produced 140,000 registrations into the New York State Donate Life Registry. We also, with the help of the legislature and the governor's office, we have lowered the age of eligibility to enroll in the New York State Donate Life Registry. New York was only one of 4 registries. There's 52 registries in the country that only allowed people age 18 and older. And so now we have joined the rest of the nation in allowing our young adults, when they're going in to get their junior driver's license, to check that box and to be our heroes and to enroll as organ and tissue donors. So a lot of momentum and a lot of positive direction. We're on a good trajectory here. But we are certainly not complacent, right? So here's kind of the bad news. Our registry, while it has 5 million people in it, we're still ranked 51st in the country. So we have a lot of work to do there. And as you were saying, Dan, it's such an important tool because it takes the stress out of that moment for a family when someone has made that decision ahead of time. It's a really important tool for facilitating donation. And so we have to put a lot of effort behind improving and increasing the number of enrollments, because there's a huge gap in New York between the number of patients that are waiting for a life-saving transplant and availability. But what you're doing in Albany County is exactly what we need. We need that leadership, that message that we in Albany County, we support organ and tissue donation. It's what we do. And we're here to help, and we are going to, we need to show New Yorkers that they can help, and they can help their neighbor, and it's really easy what they can do. We now have a new dedicated website. It's donatelife.ny.gov, where people can go day or night and document this decision. So thank you so much for everything you're doing and your leadership. It is very needed and very appreciated. Thank you.
Thank you. Next, I'd like to have Mike come up, the Executive Director of the Center for Donation and Transplant.
Thank you and good morning. Welcome to the Center for Donation and Transplants office. My name is Mike Tebow. I'm the Executive Director. We at CDT are honored to partner with the Albany County Executive's Office in forwarding the mission of advocating for organ and tissue donation in our general area. The lack of organs available for life-saving transplant in New York State truly is a public health emergency. Patients are losing their lives every day because the life-saving organ they needed to save their life was not available. Center for Donation and Transplant is the federally designated organ procurement organization servicing the Southern Tier, Hudson Valley, Greater Capital District, Utica, and North Country. Our mission is to offer hope and healing to families of patients who have passed away and to advocate for organ and tissue donation in our community. What we find is, in general, families and citizens in general are very supportive of being an organ and tissue donor. However, our job is never finished. We have the blessing of having a wonderful staff that truly is on the front line of this emergency, interacting with members of the community, interacting with our hospital partners. What we find is the shortage of organs for transplant will not be solved by one agency alone. It has to be solved through partnership. And the partnership with the Albany County Executive's Office is just one example of the many partnerships we need to come together so that we can solve this public health emergency. It takes time, it takes dedication, and without that partnership, we're not going to see this problem solved. So it is our true honor to partner with the Albany County Executive's Office, Donate Life New York State, as we further the mission of advocating for organ and tissue donation. Thank you very much.
Thank you. Thank you, Mike. I also like to thank Dr. Whalen, too, from our Department of Health for our great job and really be out in front of this initiative with my office, so thank you. Another number I just wanted to share, and I kind of skipped over it when I was talking earlier, is that 19 people a day in this nation pass away because they don't get a donation in time. 19 people. And that's something that we need to address. And that's 19 people's lives that we can save just by simply filling out a form when you go to get your driver's license, voter registration. There's many ways you can do it online, and it's so simple. And again, it's a conscious decision you have to make, but also it's about giving back. Now I'd like to welcome Dave Gray, who is with us today to talk about his transplant.
Thank you, sir.
Thank you, Dave.
Good morning, everyone. Yep. My name is Dave Gray, and I come down with viral cardiomyopathy in the summer of 2015 to bring me down the transplant path. I went down pretty rapidly. I wound up getting admitted to Westchester Medical Center on November the 30th, 2015, and everything was fine. I did great till the day after Christmas. I crashed the day after Christmas. I woke up the day before New Year's Eve. I was on an aortic balloon pump on the ventilator. So this lasted for a week or so, and they asked me if I'd be willing to go on and try a axillary balloon pump, so I could get out of bed and still wait for my transplant in the hospital. So I did that, and as the nurses had time, I walked the halls and I visited everybody. Used to make a joke about what room I was going to rent for my transplant on the other side. And that lasted through, well, actually during that time frame, this is when I tell everybody I made 2 mistakes. I like to Google. I Googled heart transplant surgery, which I didn't need to know that. But that was one I didn't need to know. 2 was I Googled organ donation in New York to find out. Of course, we were number 50. We're under 10,000 people waiting for life-saving organs, and here I am living on life support, saying we're losing a New Yorker every 18 to 20 hours. We're signing people up every 10 minutes on this list. So I proceeded to, I got to walk the halls and things were going good, but again I crashed on February 25th. This time I woke up on a ventilator and an ECMO heart-lung bypass machine. So I was on that for about 10 days, which led me down the path to the LVAD, the left ventricle assist device, which was good stuff. I mean, I was able to get stronger. I did go home, and I was able to walk my daughter down the aisle, fly to Florida, which was good because they didn't think I was going to make that at that time. And I got called from my heart on the night of August 19th, and I got my heart, and then I awakened with a donor in my mind, and I volunteer to help people all over. I do it with New York State Donate Life CDT. I help Live on New York. I volunteer 4 to 6 days a week at Westchester Medical Center for transplant people. I meet all the folks here local that are going through transplant, and I follow them through Westchester from start to finish. This is my new life. Folks, we need heroes. New York's in a crisis mode now. Please have a conversation with your family and go to donatelife.ny.gov. That's all I can say. You need to leave a legacy. You can't take them with you. That's all I can say. I don't know what else to say.
You know, it's emotional to watch it and to really think what you went through. And again, it's just not about donations. It's a support network that these organizations bring in, especially in the work environment. When you go through something like this, for an employee to really understand that they need your assistance, and you need to have that foundation, knowing that people at work are going to work with you. You got the support mechanisms, and and that's what this is what this is all about. It's just not about donation or donating. It's not about registering 500 more people. It's really about a community of partnerships that's going to make a difference. And I want to say to everyone, thank you again. And that is alarming, knowing that every 10 minutes another name's added to the list. That's something that we have to work at to get them off that list quicker, and to make more people aware of the difference that you have right here, Dave, right in front of you, that you're changing. Not just you change your life, obviously, but you're giving back and helping people go through what you went through to help them understand that. So thank you. This really ends the press conference. I don't know if the press has any questions for anyone that has spoken or no. Thank you again, but now we have a job to get out there to get people registered and really work within the organizations here in Albany County in a partnership to make it happen. So, and then I got a proclamation, which, where did I did. I left I have a proclamation for you. I left it in the car. I will bring it back into you. But again, saying thank you to everyone, and this is a great partnership, and I look forward to being well over 500 names. So again, thank you.